Hey, welcome back. 24 minutes after 7 o'clock, the FDA not ready to pull a permanent birth control off the market in spite of a lot of complaints from women.
It is estimated 750,000 women have used Essure since it was approved for sale in 2002. Now, some women have complained of severe pain, a lot of problems related to the device moving. On Monday, the FDA called on the maker of Essure to conduct a new clinical study. And Fox 4's Jenny Anchondo's in with more. Jenny?
Yeah, so the FDA will also now require that the Essure implant carry the strongest safety warning label in addition to that new mandatory clinical study. So joining me this morning is Dr. Denise Holcomb, OBGYN at Methodist Richardson Medical Center, and then Stephanie Hamilton, who had Essure but removed it because of complications. Good morning, ladies.
Good morning.
Okay, Stephanie, you had Essure, you removed it. What's your reaction to what the FDA has come out with?
It's disappointing. We think that it deserves a lot more than just an extra warning. It's hurting women, it's killing women, it's killing unborn babies, and so we're really pretty disappointed.
So those are some of the claims that the FDA is looking into, I guess, with these further studies. So Dr. Holcomb, your office does still use Essure as a permanent form of birth control. Explain your stance on that.
Correct, yeah. I'm so sorry all that happened to you, Stephanie. I will say that our office experience has been very different. In total, within 3 physicians, we've done approximately over 1,000 Essure procedures since 2003. We have never had to remove any for any reason. We've never had, that we know of, we've never had a uterine perforation, no tubal perforation. We have had 5 unintended pregnancies. Those patients had either not done the HSG afterwards, which is a hysterosalpingogram that they're supposed to do.
And what would that do?
So basically just to make sure that the tubes are blocked afterwards. Or some of them have had intercourse before the 3-month span.
Okay, so they hadn't followed the regulations.
Exactly.
Now tell me this, it sounds like a complicated procedure. Is there a potential there that these complications are coming about because it's not inserted correctly, or?
Absolutely. So there is a training program that has to occur, and physicians have to be trained to use it. Just like any other surgery, there are complications associated with it, and one of them is perforation of the uterus or the fallopian tube, and it's definitely affected on by the way that you perform the procedure. So
okay,
absolutely.
So Stephanie, you had a hysterectomy at age 30.
Yes.
To get the coils removed. Talk about what led up to that.
Well, I was having a lot of pain, a lot of discomfort, bloating, joint pain was awful. I was having a horrible skin rash because of the nickel that it's made out of, which I didn't know that it was made out of. And a lot of people say, well, why didn't you research more before you put something in your body? And just the information wasn't available when I was researching.
And you said an autoimmune issue
yes,
as well.
Psoriatic arthritis.
And is nickel not something that the doctor should be discussing with the patient ahead of time?
It is. So it is certainly something that is discussed in the product manual. However, right now, having a small sensitivity to nickel is not considered a true contraindication, but it is certainly something that you want to talk about with patients.
So now they're going to have this required list that patients will talk about. Stephanie, moving forward, I know you're not okay with what the FDA has put out. Are you going to continue to advocate for people not
Absolutely.
using Essure?
Yes, yes.
And Dr. Holcomb, when patients are going in to get this, what's the #1 thing they need to do?
I think it is extremely important for patients to have an open discussion with their physician. I think physicians need to make sure to take the time to talk about all of the risks, because it is a small surgical procedure. Just like any other surgical procedure, there are risks. So we definitely have to have a discussion.
Yeah, and there's certainly more to talk about with the time that we're allotted here. We'll put more info on our website as well for people who are concerned. Ladies, thank you so much.
Thank you, Jenny.